As we heard, the patient did get quite a bit of time on the lenvatinib, which is great great to hear. But on the other hand, developed some side effects. And the side effects of the lenvatinib, which already I have experienced with some patients, is the same like on what happened in the clinical trial. Maybe the key ones are the hypertension, and this is what we saw in our patient. Potential decrease in appetite, weight loss, tiredness. But interestingly, the sorafenib and what we are used to in regard to the hand-foot syndrome can happen, but at all, definitely not to the extent that we see to the sorafenib. And as such, I would say that the drug was acceptably well tolerated. Management of the hypertension was easy to handle with a change of the antihypertensives or addition of antihypertensives, and patients can move on with therapy. One thing, by the way, is to bring up here, it was in the study, but I was fascinated that one of the patients brought it up to me is in lenvatinib, you can take it anytime you want as a patient. While the sorafenib, as we know, it has to be on a empty stomach 2 hours before and twice per day, while this is just 1 pill a day and that's it. One variant over here, remember that the lenvatinib is guided by weight. I would say in the US it's less likely to be an issue because in general our patients who have HCC will have definitely more than 60 kilos in weight, but nonetheless the dosing will differ based on weight. 12 milligram for patients who have weight above 60 kilos and 8 milligram for weight less than 60 kilos. I'm very happy to hear that this patient was managed rather very appropriately. If anything, it saddens me that he was not caught early in the game with the hepatitis C and the potential for HCC development. However, the embolization were appropriate, but I'm glad to see that the multidisciplinary approach into the case was brought relatively early in the game, and patient was moved on smoothly from local therapy to systemic therapy. The choice of the lenvatinib is a valid one, and I'm happy to see that the patient did rather very well on it. The tolerance was acceptable, management of the blood pressure was pretty straightforward, and patient improved on. And more importantly, the response rate is definitely something that patient and their physicians were very happy about.